Cardiovascular disease is the #1 killer of women in the U.S. So this Friday, the American Heart Association is asking you to help raise awareness about the disease in women by wearing red. The movement falls in the month of February, which is American Heart Month, and this year's theme is Your Child, Your Heart.
So this month, the association is calling on everyone, especially parents, to learn infant and child CPR. So we're joined now by Julie Habelman, a heart disease survivor, and CPR instructor Manny Medina. Julie, Manny, thank you guys for being here. Good to see you. Lots of red.
Lots of red today.
Glasses are terrific, Manny.
Representing.
Love it. Okay, let's start and just talk about why red. Give us an idea of kind of the history here and the importance of the message we're trying to get across.
Julie?
Yes, so wearing red, the American Heart Association does that every year. They do a great job with the Go Red campaign, and it's particularly special to me because after attending one of their events, it prompted me to know the symptoms of me having my heart attack. So
tell us a little bit more about that. What happened?
So January of 2020, I was going about my day at home, and I started experiencing chest pains, and luckily I remembered that that was a symptom. Long story short, I had a heart attack caused by a condition called spontaneous coronary artery dissection. That occurs 90% in women between the ages of 30 and 50. So it's a condition that is still being researched quite a bit. And, you know, people are used to thinking about their diet and exercise and genetics, but it's really important to also consider their environment and your emotional standing and your relationships, because it can certainly have an impact as well.
So stress and all those kinds of things.
Absolutely.
And this happened right at the beginning of COVID. Did you think maybe it was something else?
No, I didn't. I'm quite certain that it was stress and emotional situation. With women, this particular condition is also impacted by hormones. So in and around pregnancy, in and around menopause. So it's definitely something to think about, and something that's still being researched.
So many, heart disease is the #1 killer of Americans. People probably all around the world. What do people not, it's not something we talk about, I don't feel like, as much as we talk about some of the other big ailments. What do people need to know about heart health and things that they need to do to keep well?
Well, it's really important to highlight that women do not survive as well as men do. And that's because they don't get CPR as frequently. So there's a lot of barriers often to getting the CPR, which is very important. You have just a few minutes to initiate those life-saving skills in order to be able to create, good outcomes. As of right now, less than 10% of the people that suffer cardiac arrest are actually going to survive. And so we want to make sure that, especially with women, kids and infants, that we focus on what we can do to make sure that we save the lives, of the people that we love.
Well, let's talk about it, because we're talking about children this month, and that's the theme this year. So talk to us about CPR for children, and how is it different?
Sure. So we often talk about, adult CPR, and we started in 2010 a campaign for hands-only CPR. That's great. It can double or even triple the chances of survival in adults. Now, for kids and infants, it's just a little bit different. They often do suffer from breathing problems. So breathing is a key component that we still do for kids. So you want to provide compressions as well as a combination of breaths in order to create good outcomes in kids and infants as well.
All right, so if you had to give us a quick rundown of what to know, what to do, let's inform some people.
So we, very quick and easy, you want to make sure you call for help. And then as soon as you call for help, you want to start compressions as soon as possible. People often delay that part for lots of reasons. You don't want to delay that. Start it as soon as possible. For infants, you can do 2 fingers on the chest or your thumbs encircled around their chest. For children, you would use 2 hands closer to puberty.
You're trying to beat their heart for them, right?
As fast as you can. We want to push hard, fast, about 100 compressions per minute. That works for all ages. And you just want to keep doing that until help gets there.
A little faster than the Stayin Alive.
A little faster than Staying Alive.
Yeah.
I can show you real quick.
Yeah.
It's actually very, very quick. For infants specifically, we're going to do about 30 compressions, and then we're going to do 2 breaths. Put your mouth around the infant's mouth, give 2 breaths just till you see the chest rise, and then you can let up.
So I say really good CPR, at least on an adult, you're breaking ribs. Do you want to be that hard with a child?
You know, I always say this, but we can fix the broken rib.
Yeah.
We cannot fix the broken heart. And so you want to make sure that you're not using those things to delay what's most important, because, you know, that fear can often delay from starting the CPR. We don't want to think about those things. We want to call for help when we see that person suddenly collapse, not breathe, and just push hard, fast, on the center of the chest until help gets there.
And Julie, before we let you go, because you were saying that most women don't survive, you know, because of the lack of CPR, were you alone?
I wasn't alone, and I was taken to an emergency care center, and then an ambulance was called almost immediately. And then once I arrived at the ER, I was revived twice.
Wow.
So I was lucky that a cardiologist happened to be at the hospital where I went that day that didn't normally work there and recognized the condition that I had. So.
And it's those things that she's talking about are what we call the chain of survival. Those 4 links that are very important to create good outcomes, and that's calling for help, starting CPR as early as possible, defibrillating if you have an AED available, and then early advanced care, which we're in place for her, and that's why she's here with us.
So even, we don't have to
It's
run real quick,
important.
but even if somebody's not trained in CPR, you say just go for it.
Kids as young as 9 years old are trained in CPR. We've seen stories of them doing the CPR, learning it at school, and then saving their parents. So it works.
Well, we appreciate you both, and we're glad you're still here with us.
Thank
That's
you.
an important thing. And of
Thank
course,
you.
so Friday is National Wear Red Day and American Heart Month. Head to our website. Of course, we have more information there on fox5sandiego.com. Just click on the Scene on Fox 5 tab. Julie and Manny, thank you so much.
Thanks, guys.
Thank you very much.